Good morning, class. Well, it's morning for me, so I don't know when you're going to be watching this, but it's bright and early before 8 a.m. and I'm recording a lecture. So, good morning. Week 2, Law and Ethics, Ethics and Law, however you want to say it. So, this book, The Basics of California Law, is going to be super helpful. And I don't know if you can see my mom's text message that just came through, so I apologize. It's going to be super helpful for you, not just for this class, but for the purposes of what you're going to need it for your future. The journey to become a licensed clinician is not a small one. So if you weren't aware of that, I'm sorry if I'm going to make you depressed at this point. It takes 3,000 hours to get licensed. And in that time, you're going to take some exams and then, of course, the final exam to become licensed. The journey is long because we want to make sure we have qualified and competent clinicians out there. And so I think that's why they require us to work so many hours before we can be licensed. It is a bit daunting, and all of you are very different places in your journey. And so some of you, that's like you're fresh right out of your undergrad. Some of you work full time, you're managing a master's degree. Some of you, maybe this is a second career, but you have just a lot going on your plate. And so I know it can be kind of overwhelming. Now, I'm going to go over a lot of information and about becoming licensed, and you will hear this again. So don't worry as if you're never going to hear this again and you need to take very specific notes. And this is assuming all of you even watch this lecture. However, the road to becoming licensed, some of you are becoming an LPCC, some of you are just doing an LMFT, and some of you are doing both. Okay. Now, the difference between LPCC and MFT is there's different requirements. I myself am a licensed MFT. The LPCC wasn't even an option, okay, back in the day, which makes me sound very old, and I'm not that old, but that wasn't even a thing, okay? The LPCC has been recognized in other states before California. I know it's really big in Texas or whatever. Some of the benefits of being an LPCC is like some of you don't know like where you're always going to be. And so you may think, I may move out of state, or maybe the person that you're with like has a job that causes you to have to travel. And so you want to be able to practice wherever that may be. And so the LPCC is recognized nationally. So you could move to any state and practice. Now, for those of you that are doing the LMFT, California is not the only state that recognizes the LMFT, but if you are to move to a different state, you might need to talk to, or will need to talk to, I shouldn't say might, their Board of Behavioral Sciences to see what you need to do in order to become licensed, okay? That might mean you might have to take a law and ethics exam for that state, because every state has different requirements. It just may mean you have to do some different things before you could just open a practice, okay? So those are some of the big, very general reasons why people choose one or the over the other. One is not more prestigious than the other. It's just they're two different things, okay? Two different things that are very similar. So when you are in your program, you are going to get a chance to have practicum, and you're going to need practicum in order to graduate. And what practicum is your opportunity to get your hours done, okay? So with that being said, well, not your hours done, I'm sorry, some of your hours completed. So you will be at a site with a supervisor. Now, you have to have a supervisor. You will have a supervisor until you are licensed. And that is someone that is signing off in your hours, someone you talk to about your cases. It's essential. Okay, it's really important, and I hope for all of you, you have phenomenal supervisors. But that is something that is part of this journey. And so for those of you who are going the LMFT route, the hours that you do in practicum count towards your licensure. For those of you that are going the LPCC route, those hours don't go towards your licensure. Why? I don't know. I don't make the rules. I don't think it makes sense. However, if you're doing both, what that means is that that you will be done sooner probably with your MFT than you will with your LPCC, because you'll get to start with probably a minimum of 300 hours by the time you graduate. So you won't start at zero. Okay. For those of you just doing the LPCC, your clock starts ticking of counting hours once you graduate and you get your associate number. Okay. So those are some differences as well. So you will have a law and ethics exam while you're an associate. This is nice. And you have your title is trainee while in school. Then you become an associate now. That's a new name. It used to be intern. They changed it to associate. So you become an associate once once you graduate. And then after you're an associate, of course, you take the licensing exam and hopefully become licensed. I feel as though, just with my own personal experience with my own personal associates, the title associate really helps with getting clientele, because people see, not to be misleading, but see it almost as an equal. And for some of you, you could be an associate for 4 or 5 years, not to be, again, doomsday, but it might take a long time to get your hours if you're working a full-time job where you can't count hours. And so you can be very seasoned and very experienced, even though you're an associate. Okay. So I think it's really helped for those people that are in that position to feel like I'm being more respected. And it's weird how titles can make people judgy, but they do. So we're just being honest, right? Now, in your reading and learning activities week, it shows different things: LPCC requirements, BBS requirements. It talks about the exam, things of that nature. Stuff that you're not going to need in this second, but it would be good to look over, maybe even save like on your computer so you have it when those times come. It talks about in here too, about in this book, like what causes a person to get licensed or not licensed, what kind of degree you need, you know, what even a clinical social worker degree looks like, right? And then of course supervision. Now, supervision can get very tricky. While you're in school, you're required more supervision than once you graduate. Okay. For every 5 face-to-face clients you see, now that could be group, that could be individual, that could be kids, that could be couples, but for every 5 clinical hours, you need 1 unit of supervision or 2 units of group. So some of you are like, I'm going to work 40 hours a week as a trainee. Well, you're going to need an additional, like, let's see, 8 hours of supervision. So that's a lot. So most sites aren't going to let you work that much because you need that much supervision. Okay. You're probably going to, if lucky, maybe work 20 hours a week. Okay. Maybe, because that even then would be 4 units of supervision. And that's a lot of supervision for a supervisor. Okay. Or a site. And that's like added into your week. So those are things to be aware of. Now, once you become associate, for every 10 clinical hours you have, and that's like face-to-face time with clients, you need 1 unit of supervision or 2 units of group. Okay. So usually a group is 2 hours and an individual supervision is 1 hour. Something that they now have is triadic supervision, which means 2 people could be with 1 supervisor and count as individual supervision. That used to not be a thing. And again, this is all going to probably seem like I'm talking in a different language to you, and I apologize. If you ever have questions in your journey of becoming a clinician, please don't hesitate to ask. I myself am a clinical supervisor at a couple different sites. I have my own personal associates that work for me. So I do feel somewhat knowledgeable in these things, but it is just a lot of information and it can be very confusing. This book will be very helpful for you in figuring that out and just holding on to it, because with the law and ethics exam, you're going to be able to look back to this. Now, obviously there's a newer version of the textbook. I just brought one of the older ones, but there's a newer version of the textbook, and so it's going to have like the up-to-date ACA codes and things of that nature. Codes and some of those things are going to change or be updated annually, but the basics of law is pretty standard and has stayed the same for a very long time. There might be new things, but not a lot of old things are going to change. So even if it's going to take you time before you get to the place of the law and ethics exam, the nice thing is you're taking that exam as an associate. A long time ago, you had to take it once you were on your way to being licensed, and it was like ages. Like for me, it was 6 years before I could take that test. And like my schooling was forever before that, right? So it was hard. It was like I had to relearn it all over again. So the nice thing that they allow you to do while an associate, you aren't that far out of school. So some of this material is going to be more current and be more helpful for you. So I really don't suggest like selling some of these books back. I know you might want to with some of them, but not all of them. Okay, that's just my little piece of advice there. Not that any of you are going to sell any of your books, okay? Um, but I know sometimes that can be convenient or that can be nice. So anyhow, I'm going to get to the PowerPoint right now. As soon as I move this thing off my screen, I apologize. Sometimes I feel like I'm technologically impaired. I should be very good at technology at this point after doing so much virtual therapy. I should be an expert. Okay, so we're talking about here why counselors must be aware of themselves. Our field, I'm actually reading a book right now. I barely started. It's like you need to talk to someone. It's what it's called, and it's a therapist book, and it's her perspective on clients, being a therapist, therapy. It's kind of funny actually. Some things that she's thinking in her mind as she's like sitting in front of certain clients. Anyways, our field can be very draining. Some of you are more empathetic than others. And regardless of that, we hear kind of hard things like all day long, right? And I don't know all of your personal struggles. I don't know all of your experiences. Probably something led us to the point of wanting to become a clinician. And so just being mindful of like, you need to take care of you. And that's why we require you to do your 24 hours of psychotherapy, not because we're jerks or anything, or we just want to like make you do things, but because we we see it to be important for you to have the experience of therapy, and two, we want you to maybe get connected with someone that would be someone that you would talk with in the future, or know like, hey, I can do this, and if I ever need it, I can come back. Okay. So again, personal needs of counselors come up sometimes because we don't have our own stuff resolved, and we're not perfect, right? So we feel like I need to give someone advice or tell them what to do based on our own experiences, or they remind you of someone. We want to be perfect. We need to have all the answers. Maybe want to be appreciated or recognized. Look for affirmation from our clients, which is no bueno. That's not good. Man, I have all these stupid alerts that keep coming up. I'm sorry. Again, so it's beneficial to have potentially some sort of outlet. And I don't know what that looks like for you. That would be maybe a psychotherapist. That maybe it would be some sort of lay counseling. I have remained very close with a lot of my colleagues, and so we talk about cases and things of that nature that are bothering us. I think you need to have outlets, and obviously with our line of work, we can't just talk about our stuff. And so that's where it's nice to have therapist friends, and so you can kind of talk with them about things. And we can get secondary trauma, and so it's so important that we are talking through our trauma so that we ourselves are not re-traumatized. And so again, it's a way for us to explore what's going on with us, maybe resolve some of our own stuff so we don't have as much countertransference that we can pass on to clients. And that maybe doesn't allow us to be the best therapist that we can be, and maybe we would handle a situation totally differently if we had dealt with some of our issues. I think about how I was as an early clinician till now, and I feel like I see growth, but I think of things that I'm like, oh, that was definitely countertransference that was happening there. I was very blessed with good supervisors and people that would ask the hard questions and just maybe talk with me about what's going on in my personal life. But those things come out because you guys aren't perfect. You're not robots. It happens, right? And we talk about in different courses. If you were in group with me, the group class, we were talking about even with group, sometimes it's good to be open about some things in a professional way, because you are human and it's relatability, and sometimes it's applicable, but not every scenario is. Okay. And I think, therapy is a way to really like be mindful of like, these are some things in my life. Like maybe I wasn't paying attention to this. Maybe I didn't realize this to be an issue, but now it is an issue. So they call it blind spots. I think that's like kind of nice. Like it's very easy to want to change lanes And then you're like, oh no, like there's a car there and I'm going to sideswipe someone. And so we have those, probably those our own things, right? Like we don't catch everything that is not good for us, you know? So again, transference, we need to be conscientious of that. The unreal relationship in therapy, counselors need to be aware of their personal reactions to a client's transference. All reactions of clients to a therapist are not to be considered as transference. So like not all reactions are like, oh, that must be transference, you know. Um, but yeah, you want to deal with it appropriately, you know. And I think that's when we talk about ethics. So much is about being appropriate, um, and being good with boundaries. Like our our clients may not have good boundaries. They probably don't have good boundaries. And so some of them are going to want to be like your bestie, your friend, be on your Instagram, all these things, and that's just not appropriate. Okay? And if you allow it, then they're going to assume it's okay because you're setting the tone. And so that's where it's like really important to be very like conscientious, very consistent, and knowing like I can't expect the client to set the boundaries, like I need to set the boundaries. Okay. And countertransference is when it's our own emotional response to a client, right? And some people, you're going to be like, oh, you remind me of my mother, you know, or you remind me of like a person that's really hard for me, or maybe an ex-wife or husband, or maybe someone you really didn't like in school or something. I don't know. So you got to check yourself before you wreck yourself. Okay. And so you can work through that. Absolutely. You can work through it, but you need to be aware of it in order to work through it. And so these are things, again, that you can deal with in your own personal psychotherapy, talking to another clinician, because people are people and people can really rub you the wrong way. I mean, it's just, and because it may not even be them, but it's who they remind you of or the situation, you know. Maybe you're fresh out of like grief and loss, okay? And the client that comes in is going through grief and loss. Now, their grief and loss may look very different from yours, but you might be projecting a lot of your own feelings, okay? Um, so we could do this in ways like being too overprotective, treating clients in a benign way, rejecting a client, needing constant reinforcement and approval from a client, okay? And again, that makes it not so much about the client, but more about you, and that's problematic, okay, as a clinician. You see yourself as the client, obviously having inappropriate feelings towards the client, giving too much advice, and then again, wanting an outside social relationship. Not okay. Not okay. Now, okay, like let's be real. We live in the world. Sometimes we practice where we live. You know, there's that really kind of gross saying that's like, don't eat where you poop. Um, there's some reasons for that because it's messy. And like, I just know from my own personal experience, there's been some encounters where I'm like, oh my gosh, this is so uncomfortable. Like running into a client in the Little League baseball field's women's restroom as like she's with her kid and I'm with mine. Like uncomfortable, okay? That's not purposeful. That wasn't like intentional. That was a total accident. But like those are the things that happen. And so just to be aware, like you may not always want to practice necessarily directly in your neighborhood or the school district where your kids go to school, or you know, in a place where it's like down the street from your house, because you may just naturally run into people, and that may not be as uncomfortable for them, but it could be really uncomfortable for you. Okay. And so just be mindful of that. Like, just, you know, I don't practice where I live, and I think it helps avoid some things. Now, that doesn't mean I can't run into someone at church or you know, it's just then, even then, you tell your clients, like, if I were to see you out in public, I can't confirm or deny knowing you. So I won't initiate any sort of conversation. And it's not because I'm a rude person, but it's because I'm protecting your confidentiality, right? Um, and so if they want to come up to you and say hi, that's on them. But if they don't, like, that's okay. And you just pretend like you didn't see them and you move along, right? And what's hard sometimes is when we know people, at least for me, when I know someone, like every part of me wants to be like, hey, how's it going? But then if they're with somebody else, how do they explain they know me and maybe they don't know they're in therapy? And so that's something we have to be really, really conscientious of. Client dependence. Clients can be very dependent on us. And sometimes that's part of their problem. Like they're dependent on anybody. And so making sure like you're conscientious of that, putting decision making on them. Like people ask you all the time, what do you think I should do? I don't know. What do you think you should do? That's not what I'm here for. So just making sure like you're not encouraging the dependence on you. It's not fulfilling some sort of need for you, and that you're encouraging them to get out there um, and do things on their own, be independent, not be dependent on anybody else, but especially not on you. So you can get very callous in this field. It is stressful. We have a lot of responsibility. I think certain lines of this work can be more draining than others. Like I find private practice very fulfilling because I have a lot of control, kind of, in who I see and what my limitations are and how much I work. Some of you may go into more of the public sector, and that can be very exhausting, but some of you that might be very thrilling work for you. Others of us that maybe not. And so just being mindful of like what is going to cause burnout, because burnout is capable even in the jobs that you love, right? And I think it's you're getting fatigued, you're too stressed, there's too much responsibility. You have to feel like you have to rush through clients. Maybe you're trying to be perfect and you can't. Sometimes there's a lot of pressure on notes and like getting notes done, and just like not being able to catch up or be enough. And so you don't want to get to a state of burnout and really miss out and not, even get to your license because you're so exhausted with all these other hours that you're like, maybe I shouldn't do this work. Now, if you come to that conclusion, maybe I shouldn't do this work and it's not because you're burned out, well then, okay, whatever, that's your personal choice. But if you get to that place because you're overextended, too high of expectations on yourself, too much stress and pressure, or maybe personal things came up and then it was too hard with your clients, like you really need to take maybe a step back and maybe just back off from seeing so many clients. Sometimes we're in such a hurry to get licensed, we're like, what? Like we overwhelm ourselves, okay? Impairment. So the presence of chronic illness or severe psychological depletion um, shouldn't be being a therapist at that time. If you're not in a good place and you're not all there, then that's not the best time to be a clinician because your clients are paying for you to be there. So just be aware of that. Some people I've known therapists that have walked with like seeing clients and everything while going through cancer and different things like that. You just have to know if you can put your best face forward and it's good for you to be at work, then by all means you do that. There's a lot of availability now with virtual therapy where maybe we didn't do that as much before, but a whole new world is open, as you all know. So there could be some alternatives for people who are going through things, but I think you have to know your limitations. And sometimes we want to push beyond that for our clients, but we have to know our own personal limitations. So we just have to know our own personal limitations, which again, we don't take care of ourselves. We're not getting exercise. We're not talking to people. We're exhausted. I have to be conscientious because I don't schedule breaks in my day because I work 2.5 days a week, and I like feel it. Like I see 12 people back to back, but that could create a problem eventually. And so just being mindful of those things and knowing like, hey, like I need a break. And I'm one of those people who be like, I need a week off. And so I'll take a week off. Maybe you're not talking about things. All these things could be very problematic. And so just being mindful of those things, maybe having accountability, someone checking in on you, like how are you doing? How are you managing? That's why it's important for you to stay friends with some of your colleagues, professors. You don't ever want to burn bridges because you never know who you may need in the future. And so it's important for you to take care of yourself so you can be not only the best version of yourself for you and your family, but also for the people that you're going to come across. So I hope this information is helpful to you. If you have any further questions, please don't hesitate to ask, and I wish you all the best. Have a good week.